All right, awesome. So again, thank you. Thank you so much, Tova, for that. And I just really wanted to start by saying good evening to everyone. I really am truly very excited to be joining you all today. And I want to thank Tova and the Alliance really for welcoming me into this space tonight because this really has been, I knew I wanted to do psychology in third grade. And so this has been a real lifelong passion for me, both professionally and personally. And so I'm really excited to be kind of coming into a new space with new colleagues and new people. So thank you again. As Toba mentioned, based on some of our conversations, I prepared a few very brief slides just to kind of set the foundation for any discussions this evening, and of course, to provide some kind of introductory information about psychology and pediatric care. So this is going to focus really on kind of an introduction to the who, what, and when of seeking support for pediatrics. Let's see. Okay. So I think with anything, it's always important to begin with definitions. And in terms of mental health, I think it's even more important because it really gives us an understanding of what we're talking about when we're talking about mental health. As soon as someone sort of sees that term, many thoughts can go through your mind, and some of the thoughts, might be very different than the person sort of sitting next to you or across from you. But just to kind of give us a footing, the World Health Organization and American Psychological Association, they all have similar definitions, but they essentially say that mental health is characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety and impairing symptoms, and a capacity to form relationships and cope with ordinary demands and stresses of life. That all sounds great when you think about a healthy mental state. But as we know, that is sometimes sort of the goal, but not necessarily capturing what occurs in sort of our year to year, month to month, and sometimes day to day stress states. So, what I think is sometimes most helpful is to really understand how we in sort of the psychology world view mental health as existing on this continuum, like you see here. So, when you think of healthy or normal functioning, a lot of the times for children, we think, oh, they're coping, they're balancing, they're doing things that they value. Even for ourselves, we can be doing things we enjoy. You might experience some stressors, but generally you're able to enjoy your day-to-day life. When we think in terms of mild, and sometimes you'll hear this be called reversible um, distress on the continuum, that's when you're kind of going into your daily distress, sort of. You might have daily feelings of sadness, anger, frustration. Again, with children, keeping in mind that this is usually temporary, or at least at a certain point, they've developed strategies and coping mechanisms that allow them to kind of feel confident and know that whatever negative emotions they're feeling, they are temporary, they will pass, the coping strategies will work. When you move more into this kind of moderate or large stressors, again, this can be part of normal life, like a move, changing in schools, or even the passing of a loved one. But again, when we're getting into this sort of moderate stress state, that is usually at the point that you're starting to see accompanying strong emotions, guilt, depression, grief in some stages. And we're also seeing at that point kind of this, I call it like a multi-system effect. So you might hear more words like, I don't know how much longer I can do this. I'll never do anything right. This is unfair. You hear sort of a lot of more hopeless statements. You might also, in this moderate stage, start to see more physical response to stress, like difficulty sleeping or just more tummy aches, increased pain, even in people who experience pain already, more fatigue, things like that. And then, of course, you also would see some behavioral um, symptoms like withdrawing or difficulties at school, avoiding things that typically they didn't avoid before. At this stage, it's something that we would say you you haven't perhaps reached the point that you might be considering long-term therapy or medication, but certainly maybe some benefit of intervention might be there at that stage. But it can usually be short-term and improve some strategies and then move you back kind of more towards a healthier line in the continuum. When you get to this sort of severe area, at that point, I would say more often you're talking about mental disorder or mental illness. And I think that a lot of people, when we talk about mental health, they immediately go to this mental disorder state. And that's usually just not the normal case for most of us in our day to day. Most of us stay sort of somewhere in the healthy, sometimes mild and occasionally moderate. But it's very rare that people have mental disorder. And that's usually something that is only diagnosed by a professional. And it's usually kind of a combination of genetics, environment, and a whole lot of other things sort of interplaying to reach that point. There are, it's certainly important to remember that there are a number of risk factors, again, sort of low social support, um, sort of avoidance of developing coping strategies and kind of the modeling of behavior that sometimes occur with parents and caregivers that can allow a child to sort of be more at risk for developing more moderate or severe symptoms. But to that, we also see a lot of protective factors. And one of the things that I do like to point out is that um, protective factors are not just parent caregiver, but they are siblings or the community and how the community is sort of treating children as a whole and then a child in particular. So there's a lot of ways that you can move along this continuum. And we often see it that no one person stays sort of healthy all the time. Sometimes they do tend to go into some of these other areas. And so kind of accomplishing our first goal of who needs support. So it's very important for me to often remind the families that I work with that although they tend to come to me to talk about their child, a lot of parents and caregivers are surprised that one of my early questions is, well, how are you doing? And that is largely because of the two-way relationships that really influence outcomes in the child. I think we're all really familiar with sort of the mind-body connection. Sometimes when you're anxious, you feel things in your tummy or you get more headaches. But it's also true that sometimes, of course, when you are experiencing pain, you start to worry and you start to get sad because maybe you know what that means or you know what's coming next. But the other thing I often have to remind families is that there is a two-way relationship with parents and caregivers and children as well. Young children, especially, very much model our coping strategies as parents and caregivers. But we also know, I think, as parents, that we often wear worry like a cloak. I mean, all the time we wake up with it, we live with it all day, we go to sleep with it. There's guilt, there's fatigue, there's all sorts of things. And the most common thing I hear from parents is often, well, I have to do it, and I have to, I'll do whatever it takes. And I think that's great. It's a necessary strategy, but I do think it's always important whenever I do any presentation like this that we don't forget about ourselves here because we are part of that whole sort of child's community system. And at times, I think the person least taken care of is the parent or caregiver. And that does have a direct relationship on how the child's doing as well. It's also important to just remember that We all might be on different stages of that continuum, have different coping strategies. You might have some children who are want to talk about everything all the time, and that is how they process things. Some children are more physical in how they process things. They need to go and do things. They need to take their mind off of things. And then other children they make statements like, I don't want to talk about it. If I talk about it, then I have to think about it, and I don't want to think about it. And I think that sometimes there's a tendency to view that sort of avoidance as um, not good or maladaptive, but it's not always the case. We all have different periods of time when we want to address things and different ways that we like to talk about things. So I would say if you have a child that is sort of less willing to talk about something in a given moment, if they are doing other things okay, or if they are and otherwise functioning okay, it's not always necessary to press that. They just might be at a different point in the continuum and not quite ready to delve into it. And then before I move into sort of seeking support and through whom, and I will at some point get into specific symptoms, but I just wanted to also acknowledge that, children with chronic conditions and complex medical diagnosis, they really can thrive emotionally. I think largely a lot of the literature supports that there's a lot of buffers in the pediatric space in terms of medical providers and social work and psychologists and people checking in different systems, be it school, home, hospitals. And so there are a lot of buffers that really start to build around the child and provide a great deal of support. So we do see in literature a lot of children really thriving emotionally. But of course, they remain at risk for ongoing periods of distress related to their medical condition, but also related to sometimes maybe genetically being predisposed to anxiety or depression that was aside from that, or related to just sort of the periods of development that as we grow up, um, we tend to be more at risk for certain body image and anxiety and depression and some of those concerns. So it really is, it's always important to continue to pay attention as our children get older, but also just recognize that there is a lot usually being done to support them. And sometimes the support is maybe needed in some of these other areas. So I hope this works. I did so many animations on this. I hope it works out. But I wanted to go over a few roles because a lot of times what I find is that there are so many acronyms and so many types of psychologists or mental health service providers, and particularly in the pediatric space, it's sort of, what do I need? Who do I go to get it from? Do I really need to go to all these people? What do each of them do? What's the difference? Who should I be looking
Oh,
for?
I love this. This is an area where I feel like I never know exactly what to say. So I
Oh
often
my goodness.
try not to say anything.
I find it overwhelming, and I'll say a few notes about each. I really tried to choose the ones. This is not even close to being an exhaustive list, but I tried to choose the ones that I think most often I tend to have to refer people to, or we see people sort of within the space that we work in terms of rare diseases. So the first one, oh gosh, I really hope that oh, it does, clinical psychologist. So a clinical psychologist is usually, that's kind of your real broad term. So that's someone who's going to assess, diagnose, and treat mental, emotional, and behavior disorders in a child. Of course, these can all be, except for the developmental, these can all be adult focused providers, but I'm going to talk to you mostly, of course, about children. These are people who they can sort of do it all. They do an assessment, they can do the therapy, they can also do the treatment, and they can refer to other places and they make the diagnosis as well. So that is what you'll see most often. And I will say that most of the time, what you would look for when you're looking for a clinical psychologist is mostly looking for the specialty, because even within a clinical psychology realm, they're going to specialize in adolescents or young children or a certain type of therapy like play therapy for very young children, or they may specialize in specific mental problems and issues like anxiety or sleep or depression. So it's less important to look at sort of the degree and more so just sort of what they're specializing in. A developmental psychologist, in short, they're going to focus on typical and atypical development across the lifespan. In my experience, but again, it's across the lifespan, but in my experience, a lot of parents tend to go to a developmental psychologist very early, sort of, in that kind of preschool age period. But that does not mean that you cannot go to them at any point. But because they're um, education has really focused on both typical and atypical development. When you kind of have concerns about, gosh, is my child sort of meeting expectations, even given the illness that they may have, this is going to be kind of the group that you would go to, because they're going to have sort of the assessments that will allow them to not just compare to typically developing children, but also to compare to children who may have similar presentations that your child might be experiencing. Neuropsychologist is like myself, and I will say I'm referring to a clinical neuropsychologist. So most clinical neuropsychologists are also clinical psychologists. And so we have typically developed a specialty in neuropsychology. And so all that means is that we've done additional training and fellowships related to specifically brain functioning due to medical, neurologic, or genetic factors. And so there's an additional knowledge and training in sort of medications, different types of treatments like surgeries or radiations and chemotherapy, as well as the influence of genetic factors on cognitive development. And so you would typically not go to a neuropsychologist for therapy unless they also do that as part of their practice. But typically you're going to go to them for just a comprehensive evaluation and treatment planning. A school psychologist is, I think most of you may be familiar with that, but they're a member of a school team that support the student's ability to learn. I should also have added to that that they are also working for the teacher and their ability to teach that student. So they're a really valuable member. They typically can give um, assessments, pretty much all the assessments that you would need to develop a really good school-based plan for your student. But just keeping in mind that they're also available to provide therapy a lot of times nowadays. Most school psychologists are also trained in behavioral interventions. I think the challenge sometimes with school psychologists is, of course, they are the psychologist for that school and sometimes for several schools in that district. So in terms of getting enough time, that can be challenging at times. A counseling psychologist, and I'll try to move through the rest of these. Really not much different, but this is going to focus entirely on therapy usually. So it could be individual, family, group therapy, to improve coping skills, but they are likely somebody that you would go to again if you're falling in that mild to moderate range on the mental health continuum, and you're sort of realizing, oh, I think some additional support is needed, even if a diagnosis is not indicated. This would be the group that you would go to for that. Rehab psychologist is again a person who's usually a member of a team within sort of a rehabilitation unit or hospital. They're going to focus on psychological aspects of illness, disability, or sort of the rehab plan. I would say a lot of times these are very acute and outpatient. They're really interested in monitoring progress of recovery. For example, from maybe a surgery in the adult space, it might be a stroke. In the child's case, it might be, again, an injury or some other. And so they are really working in collaboration with the physical therapist, the occupational therapist, and other members of the rehab team to, again, develop a plan for that sort of acute period after perhaps the surgery or treatment. But then beyond that, you typically are referred to another outpatient provider. Health psychologist is, again, usually a clinical psychologist as well, but they have specialized on health behaviors and coping. So these are the people that you would reach out to for additional therapies and interventions to help manage pain or treatment adherence or stress related to treatments or medications. For younger kids, these are also people who we often work with to help with things like initial pill swallowing and having to get so many shots and procedures and really acclimating them to different hospital environments and hospital procedures. Health psychologists are really going to be the key point for that. And then I do want to just acknowledge, I'm familiar with the psych world, but I truly, truly value all of the other mental health service providers. And you will see sort of things like psychiatrists, licensed clinical social workers, licensed professional counselors, licensed marriage and family therapists. You'll see all of these acronyms. The important thing to remember is that all of these people are licensed. Many of these people may have 15 to 20 years of experience providing intervention to children at the age level that you're looking at. And I would recommend strongly to consider all of these other mental health providers because oftentimes they are available and sometimes the cost can be less as well, but that certainly shouldn't be an indicator of the value of the work that they provide. And so, I promise I'm nearly done, in terms of symptoms of distress may include, I hesitated a little bit because I wanted to talk to everybody about this, but
No, I
there
realized that I
are,
forgot to give space for us to do some introduction. So we can always revisit this after you talk. We can come back to this, but there's no
sure.
like there's no stress about
Okay.
time.
Yeah, I hesitated a little because I don't know, when people come to me, I sort of say, well, what do you notice? What do you feel? Because I think for children, we sometimes, as parents, I just think we sometimes know that there's something going on, there's something different. Um, there's something different in the last week or the last day. And we may not always be able to put our finger on it because kids and adolescents, they're constantly changing beings anyway. But I would say I'll go through a few of these, but I would say when there's a question, reach out for a consultation, reach out and just bring it up with the primary provider and they can connect with a consultation. So I'll go through a few of these, but I want to emphasize that really, as a provider, I rely on the parents. If you notice something different, then I want to hear what you see, because these are common things, but they may not necessarily apply to your child. And I'll go through some examples. So we do look for emotional changes like anxiety, guilt, sadness, mood shifts. In young kids, we often see tantrums or clinginess and difficulties with sleeping and fears. Um, but again, you may also have a child that's been anxious since before you can remember. So then how do you gauge, oh, is this more anxiety or is this sort of their baseline state? And again, that would be helpful for you to sort of capture what is different about this new level of anxiety that's making you concerned. We also look at some physical symptoms. So again, fatigue or lack of energy, headaches. And the young kids I work with, some of them often say, my chest is tighter, my heart is beating so fast. My heart is beating so fast. We do see sleep changes and appetite changes. Again, I'm in young children and maybe adolescents, some of those things can be normalized, but if you're concerned, there's never any harm in asking the question. Social and behavioral things, we're looking for kind of withdrawal, kind of maybe someone's a little more impulsive, changes in social patterns or academic patterns or unmotivated. Again, if you tend to have a more introverted child, that sort of withdrawal symptom can be a little bit difficult to gauge. But what I would say for that is, I often have parents who, oh yeah, they're a little to themselves, but they talk to so and so, or they talk to me. And if you're feeling even that's a little bit different, that might give you some cues that there may be some concerns there. And then again, cognitive changes, sort of difficulty concentrating, remembering things, decision making, confusion. I think we're all familiar with the worry, worry, worry. I'm thinking about it all the time, or the worst possible thing's going to happen. And as another plug for self-care for the adults in the room, I do think that some of these things I see more in sort of the adolescents and the adults. And they're just attributed to, oh, well, I forget things all the time. So just also for yourselves, pay a little bit of attention to if you see some of that. And so the big question is sort of when to seek support. And I know we'll have some discussion about this. In terms of if you were to ask sort of from a book perspective, it's sort of clear if symptoms have persisted for greater than 2 weeks and there's a change in functioning. But again, I think if there's an upcoming concern that you have, if there's something that is maybe hasn't quite been 2 weeks, but you just feel that something is wrong or you are worried, there's never any harm in reaching out uh, before this point. I think that this is what, from a diagnosis standpoint, a psychologist has to sort of document that there's been something going on for 2 weeks and that there's a change in functioning, but that doesn't necessarily mean that if those things are not present, that you don't still need support. I also just wanted to note that I think when people think of intervention or therapy, they think often of this long, drawn out, potentially multi-year process, and that is really not encouraged as much. There's not a whole lot of evidence backing that up anymore. And so I think that, consider if you have concerns, if there's a targeted evaluation or intervention that's needed. Do you have concerns around sleep? Because there are interventions for children and adults that can be, 4 to 8 sessions that are very effective for improving sleep. There are interventions that can directly affect treatment and medication adherence, as well as pain management. And then there's also future planning that you might be thinking about, planning for care and caregiving, planning for school or vocational things. This is probably the only one that I would say the earlier the better to reach out to somebody to get that evaluation. And then lastly, before I stop, I just want to also note that, consultative input is beneficial. I know that it seems like once you call a psychologist or a care provider and they have that initial intake appointment that it's like, oh, now I'm going to start this. You don't have to. Sometimes it is okay to say, I don't know if I even need to be here, but I need to talk to somebody about what I should do, what I should look for. Are you the best person to do that? Or do you recommend that I go another route? And most all providers are very happy to sort of have a one-time consultative appointment with you. That sometimes it can give you everything you need, and other times it'll at least point you in the best direction, and you can feel pretty confident that you're moving forward in a good place. And at this point, I will stop there and see if I can stop sharing my screen and we can open it up.